All right, welcome everyone. Look, if you're gearing up for your clinical rotations, that basic suturing simulation lab, it's basically your first real proving ground. So let's just jump right into this explainer. Consider this your ultimate pre-game briefing to get your head fully in the zone before you even think about picking up a needle.
Because let's be real here, mastering basic suturing isn't just about checking some box for graduation or, learning to tie a pretty knot. The stakes are incredibly real. Every single stitch you place is a direct line to keeping your future patients safe and actually promoting proper healing.
Now, it's totally normal to feel a bit of pressure right now. Do you actually know exactly what to expect when you step into that lab room? Well, we are going to strip away all that anxiety today. We'll walk through the exact environment, the specific training style you're going to face, and, of course, those rigorous safety protocols. So, here's our game plan for today. First, a quick welcome to the lab. Then we'll break down Peyton's 4-step approach, cover the 10 essential steps, and finally, prep you for the final assessment.
All right, part 1, welcome to the lab and preparing for your clinical trial.
Your orientation script actually hits the nail right on the head here. It says mastering basic suturing is essential for patient safety and effective care. I want you to think of the sim lab as your personal sandbox. It's literally the one place where you can build up that vital muscle memory and, make your mistakes without absolutely any risk to a living, breathing person. Moving on to section 2, Peyton's 4-step approach. These are your rules of engagement. Now, they aren't just going to hand you a needle and say, good luck. You're going to be trained using what's called Peyton's 4-step approach. It kicks off with a completely silent demonstration from the trainer. After that, they'll break it down for you step by step. Then comes a fun little twist. Step 3 is where you actually instruct the trainer on what to do. And finally, only after all that do you get to perform it independently. I really want you to notice that crucial role reversal between steps 2 and 3. First, the trainer's doing the talking, but then, boom, you are forced to vocalize the entire procedure and direct them before you ever even physically attempt it yourself. This isn't just some random exercise, guys. It's a highly deliberate psychological tool designed specifically to hardwire these steps right into your cognitive memory. Okay, section 3, the 10 essential steps. This is basically your arsenal for the do checklist. Now, before we dive into the actual steps, we've got to talk about the grading rubric. You absolutely need to understand what a critical safety mark is. You'll see it marked with a little asterisk on your checklist. Basically, a critical safety mark is any step that if you mess it up, directly compromises patient safety. So, failing one of these, it's not just a minor point deduction. No way. It is an absolute deal breaker for your assessment and obviously for patient care. All right, let's look at the first 5 steps. Step 1 is obtaining informed consent. And hey, notice that safety asterisk right there. Next, step 2 involves meticulously preparing your instruments. Step 3 is another one of those critical marks, maintaining strict aseptic technique. Then, for step 4, you've got to load the needle correctly, which means grasping it right at the junction of the middle and posterior thirds. And step 5, keep it gentle. Gentle tissue handling is key to minimizing trauma. Let's zoom in on step 1 for a second. Why exactly is consent a critical safety mark? Well, it's pretty simple. You literally cannot touch a patient without their informed agreement. They need to know the procedure, the risks, and the benefits before you even think about setting up your tray. And that high standard of safety carries right over into step 3, which is another critical mark, aseptic technique. Look, maintaining a sterile field is not just some nice-to-have clinical ideal. It is your absolute frontline defense against catastrophic patient infections. A sterile field is simply non-negotiable. Rounding out the back half of our checklist here, step 6 requires a 90-degree needle entry, and yep, that's a critical mark. Step 7 is tying a secure square knot, also critical. Then we have step 8, maintaining consistent spacing along the wound. Step 9 is all about trimming that suture tail down to about 5 millimeters. And finally, step 10, safely disposing of your sharps, which is our last crucial safety mark. So, why the big fuss over a 90-degree needle entry for step 6? Well, driving that needle in perfectly perpendicular actually forces the wound edges to evert, meaning they turn slightly outward. It's kind of like folding a hem on a piece of clothing. That outward turn is the exact secret sauce that guarantees the tissue is going to heal cleanly and properly. Now, step 7 is all about tension. Your square knot basically has one job and one job only: hold the tension and never ever slip. Because think about it.
A slipping knot means the wound literally reopens, which completely compromises the entire healing process right then and there.
Which brings us to your final critical safety mark, Step 10, Sharps Disposal. Honestly, perfectly healing the patient doesn't mean much if you end up accidentally sticking yourself or a teammate with a contaminated needle. Immediate disposal straight into a designated container is exactly how you protect your entire clinical team.
All right, last section, number 4, the final assessment. This covers your independent performance and feedback.
So, bringing it all together now, during that final step of Peyton's approach, you are flying completely solo. Your trainer is going to step back and evaluate you strictly against that DO checklist we just ran through. They are hunting for absolute safety, precision, and solid technique. But hey, the good news is you'll get immediate, structured feedback to really polish those skills to absolute perfection. So, what's the big takeaway here? You need to review these 10 steps relentlessly before you ever walk through those lab doors. Visualize them until they're literally second nature. Because, as they say, in a high-pressure clinical environment, you don't rise to the level of your expectations, you fall to the level of your training. So I'll leave you with this. When the time comes, will your muscle memory be fully ready to protect your patients? Thanks for hanging out with me for this explainer, and we'll catch you next time.